Team. Thank you, Nelly, for that introduction. Confirm that you are able to hear me.
Good afternoon, Celine. We can hear you.
Okay, thank you. So I hope we are going to have quite an interesting time. I hope we are all aware that healthcare management is a training that's take close to 6 days. So I'm going to trust God that I'm going to do this overview in 1 hour, and we are going to learn a lot. So if you have any concern or question, you can be able to share them through the Q&C, and then we'll be able to go somewhere. So the outline of the presentation include the learning objective, introduction, source of healthcare waste. We are going to look at the advantages of healthcare waste management, hazard or risk of healthcare waste, categories of healthcare waste, general characteristic of healthcare waste, waste segregation, waste management, best practices. Then we are going to go through the summary. So looking at the objective, we are going to define healthcare waste, recognize the advantages of good healthcare waste management, hazard of healthcare waste, classify a hazard or healthcare waste, identify factors that affect the rate of waste segregation, apply the improvement measures of waste management, articulate the types of hazard for healthcare waste, and implementing healthcare waste disposal. So thank you so much, and I hope you are going to enjoy the session. So in looking at the introduction, we see that healthcare waste management is a process where there is proper hospital hygiene, which leads to proper hospital waste hygiene and safety of the healthcare workers. So it includes planning and procurement of staff, items that are needed, and staff training, staff behavior, proper use of tools, machine, pharmaceutical, proper methods inside and outside the hospital, and also an evaluation. So we are looking at the definition of the healthcare waste. So this actually refers to all the waste from the healthcare facilities. All the waste that are generated from the hospitals, we call them healthcare waste. The medical research facilities and the laboratory, the research centers. So it may be in form of solid or liquid. As we are aware, we also have chemicals and that are being generated in our healthcare facilities. Then in addition, it includes the waste originating from minor or scattered sources, such as that produced in courses of healthcare undertaken in the homes. For example, the CHVs currently are doing some basic tests. So we also consider that as a healthcare waste. So according to biomedical waste rule, that is in 1998, biomedical waste means any waste which is generated during the diagnostic, treatment, or immunization of human beings or animals, especially in our research institutions. So we have sources of healthcare waste. I believe all this is known to us. We have the health facilities, we have the physician's office, the clinics. We have the medical research and training establishment, the mortuary, which is very key. We have blood bank and collection centers, animal house, especially where we do research and we use the guinea pigs and other animals. We have the slaughterhouse, the laboratory, vaccinating centers. We also have the biotechnology institutions. So healthcare waste includes a broad range of material. We have the used needles, the syringes, soil dressing, body parts, especially in histological departments. We have diagnostic samples. We have blood, chemicals, and pharmaceutical. There is also a bit of radioactive material, especially in our level 4 hospitals, and part of level 3, we have radioactive materials. Then we have waste from research facilities and laboratories. So healthcare waste management. So when somebody is to ask, what is healthcare waste management? So we can define this as a process to ensure proper hospital hygiene and safety of healthcare workers and community. So the major focus when we are doing a good healthcare waste management system, we think of our environment, our workplace, which is also very key, to ensure that the hazardous material are not leaked to our environment setup. So it includes planning and procurement. So we need to have a healthcare waste management plan. Then how are you going to procure the material that you need to help you undertake the process? Then we have construction, like we need the construction of the waste disposal sites and other things. Staff training is very key and behavioral change. Then we have proper use of tools like the documentation, the machine, like in a good healthcare waste management system, we have things like weighing balances, which are very key. Pharmaceutical items, then we have proper disposal methods inside and outside the hospital and the evaluation process. So healthcare waste management system enable healthcare waste to be managed responsibly without harming the community and the environment. So when looking at the hospital waste, think about the endpoints. We see like most of our setups, we have the boreholes. So if we really don't manage our waste well, some of this waste might end to our borehole. And let me give a good example of the laboratory waste. We have waste that we dispose, like the stool sample, let me say, and probably this is a stool sample that had cholera. So if we really don't dispose it well, it might end up to our water sources, the lake, the rivers, and even the vole. And this can lead to spread of cholera within that particular community. And that is why it is very, very important for us to consider proper waste management system. So what is the advantages of good healthcare waste management? It helps in control of nosocomial diseases. And actually, this is very key. In our hospital setup, if we don't really maintain waste well, it can lead to the spread of diseases that actually patients acquired when they are in the hospital. Reduce community, it will help us to reduce community exposure to multi-drug resistant bacteria. And I believe for the lab officers, we understand this well, how this multi-drug resistant can be spread. Dramatically reduce HIV/AIDS, sepsis, hepatitis transmission from needles, and other improper clean disposed material. Then we have control zoonosis. So when we manage our waste well, we are able to control zoonotic diseases, which is very, very key. It cuts the chain of infection. If we get time before the year end, we are going to look at IPC. And then we'll see how this chain of infection, we can break it when we do our proper healthcare waste management system. So easily and cost-effectively address healthcare workers' safety issues, including reducing the risk of needle stick injury. So when we manage our waste well, actually, we are capable of protecting our healthcare workers, especially the staffs that handle our waste, because it is going to reduce the needle stick injury and then exposures to highly infectious pathogens like the ones that causes hepatitis and HIV. So it prevents illegal repackaging and resale for contaminated needles, especially when we are in sites like in Mombasa, the coast where we have several intravenous drug users. If we don't dispose our needles well, so they are likely to pick up these needles again and reuse them again. And that is why it is very key, especially in laboratory where we generate most of this needle. It is very important for us to manage our waste well so that this waste do not end back to the community and cause risk to our colleagues or community in general. So avoid negative long-term health effects, e.g. cancer, from environmental release of toxic substances such as dioxin mercury, and others. So hazardous waste management program are designed to meet or exceed compliance with the national and local regulation. So we have a hazard, actually we call them risk of poor healthcare waste management. It exposes the healthcare workers to infectious agents, which I've also overemphasized. It contains toxic or hazardous chemical or pharmaceutical. They contain sharps, which can cause injury. It is genotoxic. We have some chemicals that can physically cause or cause genetic alteration of the genetic material or the DNA within the cell if you are exposed to them. Then some of them are radioactive, which can also cause problem for us. So actually looking at that picture, I hope we are able to see it. That is a case where we have improper waste management. We see the sharps are mixed together with the boxes, everything else is scattered, and you cannot really define now, how am I going to manage this waste? And this might lead to health problems like infectious diseases such as hepatitis. It can also lead to contagious diseases such like scabies. Then poisonings due to chemicals and pharmaceutical waste, very important. Like for example, we have some chemicals that when you look at them, basically they look like water. So when we really don't dispose them well, even the children within the community, for example, ethanol, when ethanol is just placed in a bottle, it looks like water. So we might be exposing even the children working within our environment or playing within an environment, and they might think that is water, and that might lead to poisoning and even death. So we have genetical problems, especially in these genocytic chemicals. We have cancer, which can be due to accidental exposure to unnecessary radioactive emission. So what comes to our mind? How do we expose how do we dispose our radioactive materials? So we have injury due to sharps. So those are health problems that can be caused by poor disposal of healthcare waste. So we have categories of healthcare waste. So how do we classify this? Classification is based on national regulation and international guidelines. And this actually varies between nation to nation. Like in Kenya, we know we classify them into sharps, infectious, highly infectious, and the general waste. So in our classification, we also look at types of risk associated to waste. Yeah, is it causing high risk? Is it causing medium risk? Does it have no risk? Like the way I will dispose paper is different with the way I will dispose a contaminated cotton wool. So we look at the physical injuries there. All sharps and waste, we need to isolate them. Chemicals, how do we expose the chemicals? Then looking at another way of classification, we do them according to cleaning, solvents, destination, and treatment methods. Yeah. So we have waste that actually require autoclaving. We have waste that we can generally burn. So we have waste that are generated as per different department. And I will not go deeply into this. When the slides will be shared, you'll be able to look at this. But I'll give an example. Like, for example, when in your medical laboratory, you're working in the lab, we have sharps that are being generated in the labs. So these sharps are needle. We have broken glasses. We have the Petri dishes. We have slides. We have the cover slips. Then we have the broken pipettes, especially the glass pipettes. Then under infectious and pathological waste, we have the blood and body fluids. We have microbiological cultures and stock tissues, infected animal carcass, especially in our research laboratories. We have tubes. We have containers contaminated with blood or body fluids. We have a lot of pathological waste and even tissues that are being generated in the laboratory. So we also have chemicals and cytotoxic waste that are being generated in the laboratory. So here we have the fixatives, especially in our histological lab, formalin, xylene, toluene, methanol. So methylene, we even currently use it in our parasitology lab. Then we have methylene chloride and other solvent. We also have the broken laboratory thermometers. So non-hazardous waste, sometimes we call them general waste. We generate a lot of packaging papers. We have the plastic containers. So the rest, I think we will get from the slides when we get them. So that one also just give us the different departments. Another key department that we really have to look at because of the kind of items they generate is the dental offices. So they also have the needles, the syringes, the broken ampoules. So infectious and pathological, they have cotton wool, gauze, glove, masks, and other material contaminated with blood. And then we also have the dental amalgam, and we have spent disinfectants. So this one needs to be handled very carefully because they sometimes, we call them cytotoxic waste, which might be harmful to the environment. We have the packaging papers, the office papers, the newspapers, magazine, and uncontaminated glass and mask. So the rest, I think we can get from the slides when we receive them. So we have the general characteristic of waste, healthcare waste. So in ideal situation, we see that in total waste generated in hospital is 2 to 4 kg per bed per day. So that means if we have our general ward and you have like 40 beds, then your waste approximation, if well managed, for the waste that is generated per bed is 2 to 4. Then we have infectious waste. Per bed, we only have 0.2 to 0.4 kg per bed. That means infectious waste that needs high level treatment when it comes to disposal. Then we have the average bulk density of healthcare waste. That is about 100 to 200 kg per cubic. So we have the WHO recommendation of classification of healthcare waste. And this is the system that Kenya has adopted. We have the type of waste, we have the color of the container and markings, then we have the type of container. So we have the highly infectious waste. So highly infectious waste, in Kenya, we have 2 bins. We have the red bins and we have the yellow bin. So they both carry the highly infectious waste. But we know that in our red bin, we put the sample that have the pathogen. For example, a tube with blood, we are expected to dispose it in a red bin. But now if we have a cotton wool that has been used to do swabbing, we dispose it in a yellow bin. Yeah, so the type of container, it should be strong, leak-proof, plastic bag or container capable of being autoclave, especially for the highly infectious that goes into red. So we have other infectious waste, pathological and anatomical waste. We said in our Kenya system, it goes into red, but WHO says that we can do this in a yellow bin with a biohazard sample. Then we have our sharps. This is universal because currently we have the sharp containers that are being used and they have the biohazard symbol. So something to note when you are choosing or when you are purchasing a sharp container, it is important to consider that the patch, it is puncture-proof container. Then we have the chemicals and pharmaceutical waste, which basically are being disposed in a brown label containers. We have the radioactive. So this radioactive, sometimes they use the gray and it needs to be labeled radiation. And mostly they recommend the lead containers. Then we have the general waste that goes into black. And this is basically a plastic container. I believe we've all seen this chart. So this is the basic chart that we use in our Kenya system as a guide to help us in waste segregation. So what is waste segregation? So this is simply the separation of different classification of healthcare waste from each other, beginning at the point of generation and maintaining the separation during storage and transport until the treatment and final disposal. So something to note when we are doing our waste segregation, it is important that you segregate your waste at the point of generation. And then the person collecting the waste should maintain that until you reach the final level of waste disposal. So we have the minimum classification that is of waste, healthcare waste as recommended by the WHO. So we have the type of waste. This is the minimum. But I said, like in Kenya, we have 4. So the WHO recommends sharps to be in the sharp container as the type of waste. Then we have the infectious waste to be in yellow bags. Then we have the general waste to be in black bags. So that is the bare minimum, meaning in a site that is developing or generating waste, you are expected to have the 3, especially in an hospital setup. So if you have less than 3, meaning that you are not meeting the WHO minimum expectation of waste segregation. But the maximum currently we have 4, though we have other setup, like when you look at Kenyatta National Hospital, they have other types of bin, like they have the yellow, they have the clear, that basically help them when it comes to waste recycle. But for the WHO, the bare minimum is 3. So red bags for highly infectious waste and transparent bags for general and recyclable waste are also good option that we really need to look at. So for you, actually, when you have a scenario that you want to do waste recycling in your setup, you can come up with another bin, and this will help you to isolate or segregate items that can easily be recycled, like the water bottles can currently be recycled and be sold. You can also use them as an income generating activity. So why do we segregate waste? Actually, it is very important for us to segregate waste to reduce the amount of waste that must be treated as hazardous. Because sometimes you realize that just like we are going to see that the majority of the waste is the general waste. And it is very easy to treat or to final dispose the general waste like we do for the domestic waste. But now if we don't segregate our waste well, it will increase into our cost because of the mix-up of the waste. So it also reduces the risk for workers, especially those who are handling the waste. Then to lower the cost of treatment and disposal, to make waste recycling possible, like the boxes we generate in the pharmacy, we can easily use those ones. We can easily use those ones to enable us earn some income by selling to our clients. The bottles, we can recycle them. Then to make waste recycling possible and to reduce the environmental impact. And I want us to underline to reduce the environmental impact. You realize that as we mismanage our healthcare waste, think of the water bodies. And these are things that we consume. Think of the air, like for example, our sputum marks. How do you make your sputum marks leave your laboratory to the end disposal? Did you think of making it inert or disinfecting this sputum? Because if you don't do that, chances are is that the air is going to be contaminated because the bacilli is airborne. So we really need to do that to reduce the impact to the environment. So we have risk of improper healthcare waste management. So waste of money, there will be waste of money because of increased waste disposal cost. Waste of resources, like recyclable item will not be possible. So you'll be wasting a lot of resources. Then risk to healthcare and waste workers, and the public in general. So we have hazard chemicals in autoclaves. You'll find yourself putting some hazardous chemical in autoclaves, which might also cause an injury to the people working on the autoclaves. It can also lead to nuisance, e.g. smells, pests, that are being attracted by some food items, especially the ones that are being generated in the ward. And even in our laboratory, you realize that when we don't maintain our waste well, we don't clean our bins, we have high level of pests like the ants flowing into our laboratory, which is also a risk to the environment. So we have the general healthcare waste classification. So when properly segregated, 85% of or more of the healthcare waste are general waste with the same risk as the domestic solid waste. So meaning you see the dark green part, that is 85%. That is general waste, that is non-hazardous. So what I need is I just need a pit and maybe a matchbox, burn my waste, and the disposal is over. So we only see 10% of infectious hazardous, then only 5% of radioactive materials. So when we segregate our waste well, then we'll be able to manage our health care. So we have said that coding of the bins are different. Just like we see the four there, we have the black, we have the blue, we have the yellow, and we have the red. I know we are much familiar of the black, red, and yellow, but the blue one is coming in, the clear one is coming in because some people are using them to segregate food items. Some people are using them to segregate bottles. Because you see, like food items can be recycled. For those who are having pigs, you can sell to those who are having pigs, those who are rearing chicken in large quantity. So you can use them as an income generating activity within your hospital setup. And it is also very important to have them differently labeled so that it is easy for identification and also in preventing accidental mixing of waste. And something that I will have to emphasize, when you are working in a general ward, or maybe even in our outpatient clinic, even in our laboratory, sometimes it is always very important to translate the labels writing into the local language so that you don't get your patients also mixing the waste. So we have waste containers. So the containers for collection of infectious waste have to be leak-proof. That is very important. When you are doing your purchasing in your HMT, you have to give a specification of the type of container that you need. Leak-proof container, metal containers can be used, especially in radioactive area. They should be color-coded to the country color coding system, like for us in Kenya, we know, and marked with biohazard symbol. Very important. And if you are in the Luo, like I'm in a Luo land, sometimes for the waste bins that we put along our corridor and even in our wards, let us put there a language that can easily be interpreted by the local facility. So bag for the waste bins. So bag should be of the same color as the hard container. But now we have a question. How realistic is this? What works in your country? What compromise is acceptable? So I would want to say that this is realistic, especially when you have a healthcare waste management plan. Because during this plan, you will be able to calculate how many waste bags do you need to take you through a certain period. And that is why as the laboratory officers, especially the lab managers, you really have to know, well, how many bags do you need? Like you are in a high level hospital, in a parasitology department, where you are handling stool and urine, you are expected to empty your bin maybe 2 or 3 times in a day, depending on the level of your work. How many bags do you need in that department? That will make it very realistic. Because as you do the purchasing, maybe in a quarter or a year, you actually know the amount of bin liners that you require. So the plastic bag and the bin should have the biohazard symbol prominently displayed, cautionary marking on the outside of the bag written in the local language as have been recommended. Then we have the polypropylene bags to be used for waste to be autoclaves. So these are just heavy and heat-resistant plastic bags that we can use to autoclave our sample. So that is just a pictorial of the guide. And we always expect this to be our job aids in our working system. So you are a nurse or you are a clinical officer. You are handling your patients during ward rounds. So how should you organize your tray? You are expected to have the expected bins. You are expected to have your sharp container. And of course, you are expected to have your hand facilities. So that is very important, and we need to advise them on how best they can be handled this. So those are very different types of sharp containers that we have. You see the first one here, this is commonly used by the CHVs in advanced area. Even this one can be used by CHV. So this is the one that it is being said autoclavable metal, meaning that we can recycle this and use. This is good, but not recommended, especially where you are able to get resources. Ensure you have the right sharp container. This is the one that is commonly used, but if you can get a yellow one, the better. So this is actually the sharp containers, sharp boxes. So the following should be disposed of in the sharp box. We have the syringes and the needles. Please don't separate the syringe and the needle after use. Don't also recap. So syringes with needles removed, especially if you have a needle remover. But if you don't have a needle remover, ensure you dispose of the entire contents in the safety box. So we have needles with infusion set removed. For example, you are doing a blood transfusion, or you are doing IV infusion. So you have to cut off the part that have the bag and then dispose of the needles. We have the scalpel, the blades. We have the broken glasses. So those ones we can put them in our sharp containers. So where do we do this one? We have too many infectious waste bins. Like for example, you go to a facility and then there are too many of these waste bin in the family, meaning that they don't do the disposals as required. In the wrong location, these tend to inflate infectious waste volume and undermine the segregation. Like for example, when you are doing your facility safety audit, which is also a very key component in the laboratory system, you realize that they have a holding room. And mostly they use the full pit latrines as their holding rooms. And then there are so many infectious waste material there until the ants are developed in them. So that one now, it undermines the segregation process that probably has been well done. We have too few infectious bins. Where infectious waste are generated leads to discarding of infectious waste within the regular waste, thereby undermining segregation also. We have infectious waste bins not being placed. So in areas where no infectious waste is generated in public areas unless absolutely necessary. For example, you meet a yellow bin or a red bin on an hospital corridor. So that bin has been misplaced because you expect the patient to get contaminated cotton wool in the corridor. No. For example, a good phlebotomy technique, you are not supposed to release your clients from that room before you remove that cotton wool. So we don't expect a yellow bin outside, but we expect black because your client might be taking banana or some food item, disposing some peppers. So we really need to think, where do I dispose this bin? In some facility, you go to the corridor and then you find the red bin, yellow, black, plus the guideline placed there. So that's a misplacement. So in areas where both infectious and non-infectious waste are generated, Both containers should be strategically placed near each other so as to facilitate segregation. For example, in your HTS room, in your sample collection room, in your sample processing bench, we expect those bins to be at the close range plus a guide in it. Then sharp containers should be within arm's reach. You have to just stretch your hands and dispose your sharp. That is very, very important. We realize that some of us, we really put our sharp containers very far, very far. So we really need to reorganize ourselves and ensure it is only arm's reach. So we have infectious and sharp bins should not generally be placed by the patient's beds. And this is very key. Don't put a sharp container next to a patient bed, because sometimes we might have patients who are psychologically disturbed and they might use such items to harm their colleagues. I believe you all remember instances that have been happening of late in some of our hospitals. Trolley should have the infectious waste container for contaminated swabs or dressing, and an infectious waste container for clean packaging and regular waste, a needle cutter or a sharp container so that the nurse can dispose use syringe immediately. Sometimes it is so frustrating. You have a patient and you are a lab officer, and then you see somebody comes to remove blood. He's just carrying the needle and the gloves on his hand. Then he tries to withdraw blood, but attempts several occasions, and then he uses the same needles. Anaweka kwa bedi ya mgonjwa. So ensure when you are handling your patient, you have everything on a trolley. It also looks professional, and it also boosts your academic or your professional activity when you do things the right way. So infectious and non-infectious waste containers should be in the nurse's station, treatment room, or other areas that patients and visitors cannot access. This is very key because we might have some of our patients who will want to go and sort out waste. Probably they will get something good outside there. So if the facility recycle non-hazardous general waste, marked containers for recyclable, such as paper, packaging, plastic bottle, or aluminum cans should be conveniently located for public use. Chemical waste containers should be in areas where chemical waste is generated, such as pharmacy, laboratory, and engineering department. And I believe we are all aware of the yellow chemical candidate that is being used to safety store our waste. So we have problems that are associated with some of the waste that we generate in the hospitals. Like we have the chemical waste containing heavy metals. I know the public health system is trying to eradicate mercury, but some of these items still sneak into our hospital setup. So we really need to understand what should you do when a broken thermometer that is made of mercury. I know we are trying to do away with them, but some of them still get into the market and land in our hospital, even in terms of donation. Then how do you handle the fluorescent batteries and the lamps when they broke? So looking at this picture here, you will see that this is a plastic and a heavy metal has been placed in it. So meaning there is a risk that is there. So that is very, very important. So dealing with segregation. So never attempt to correct errors of segregation by removing items from bag or container after disposal, or by placing one bag inside another bag of a different color. Sometimes I always encourage the IPC coordinators or officers that appear in the hospital at 6 a.m. and actually sit down and monitor how the support types handle waste. You'll find them, they go to the laboratory department, pick that waste. Instead of renewing the bag, they pour into another bag that came from the MedSoup's office. So they combine. So they don't exchange the waste, but they just mix the waste. And sometimes when I do IPC training, I do ask, suppose you are using your pen or your phone where you are doing phlebotomy, and your phone now falls into a yellow bin. or you had money in your pocket and it fell in the sharp container. In good waste segregation, you are not supposed to remove that thing because it is already contaminated. So what am I trying to say? Concentrate on what you are doing so that you don't mix up yourself and contaminate yourself because of waste. So if general and hazardous waste are accidentally mixed, yeah, the mixture should be treated as hazardous healthcare waste. Probably now you are handling your pen and now your pen fell into a yellow bin. So just leave it there and now we'll handle it as hazardous waste. And that is why you go to some setup, you'll find that when you enter the laboratory, you are expected to put your valuable in a certain corner, your phone and everything, so that in case of anything, your phone does not fall in a yellow bin. So monitor segregation and reinforce training. Don't just say, me, I'm an IPC coordinator or I'm an IPC focal person. What do? Do you monitor how your support staff handle waste? I believe we all know about this chart, and this is just good. Some of these job waste we should have in our sites. So we have a waste management plan in our facility. So we have here, we have all hospital units. So they are all here. So looking at this thing here, we have our where waste are coming in. We have the cleaning and housekeeping. We have the clinical waste, recyclable waste. We have the general waste. We have the catering unit. And looking at this plan here, we have the collection area. And in that collection area, we have the office. Then we have from the office there, we collect the waste. Then we have the bin wash. So do you wash your bins? So that's a question we need to ask ourselves, especially the lab safety officers and the lab managers. Are your bins being washed? Then we have the bin holding area. So that is where we have the loading dock. In the loading dock, we have the dirty dock, and then we have the clean dock. So when you are working on your plan, you need to think about that. Then who is responsible? Some people say casual, some people say support staff. No. But we are getting in today that it is the responsibility of the person generating the waste to ensure that all procedures are followed to ensure safe and environmentally responsible disposal of the waste. So when I get into your lab, I'm doing a safety audit, get into your phlebotomy room, and I find glove in a black bin. When I ask, it is so much irritating to get a feedback that those are students who have done that. When a student gets into your lab or a student gets into the hospital, the first thing you need to do is to do an orientation, which include proper waste management. So waste generation, at the point of waste generation, we do waste handling, we sort our waste there, storage and processing. Then the person who is coming actually should get a closed product, a product that has been closed, labeled, and sealed, ready for collection. Then they do process and recovery. It can also be done for transfer and transport, then finally to disposal. Then we have waste management. So there is a process of waste management. The first process is waste minimization, which I didn't include there, but I'm going to talk about that. Then we have waste segregation. We do our packaging, labeling, handling and storage, transportation. Then we have disposal. So what is waste minimization? So this clearly refer to approaches adopted by the health facility to reduce the amount of healthcare waste. Like you can come up with strategies to reduce injection. If a client is suffering from malaria, we have orals, and then we also have injectable. Then I can say, oh, this my client can basically be managed by oral. Let me give my client oral. It will reduce the number of injections, which might be 6 or 4, that will lead to 6 or more sharps compared to orals that will not generate a lot of waste. We can also decide to recycle our bins and help us in generating income. So waste minimization help us to reduce the waste. It helps us in stock management. It helps us in achieving stock management, encourage the use of recyclable product, then centralize purchase and monitoring the receipt and supply produced to the medical groups. So now waste segregation means separation of the entire waste generated in a facility and keeping different kinds of waste separately in defined category. To the extent that when they do safety audit, when I look at yellow bin, what I see in yellow bin is what is expected to be on a yellow bin. Then I will say you have achieved proper waste segregation. Then waste segregation ensures that the waste will be treated according to the hazards of the waste, correct disposal rules, and correct transportation equipment is used. So we have different category, and I think this one have been overemphasized. We have the general or non-infectious waste, and basically we handle this like a domestic waste. Yeah, we have infectious waste, which contaminated material for autoclaving and disposal. We have highly infectious waste, which include anatomical and pathological waste. We have the sharps. So individual health facility may include other categories, like we have others have improvised the blue for food, some are using clear, depending on how best it works for you. So the importance, it helps healthcare workers to generate waste or to segregate waste at the point of generation. Please, when you are in phlebotomy, when you are in medical ward, when you are in maternity, segregate your waste there. Don't call casual now to segregate the waste for you. Yeah? Waste should never be resorted. You go into a place already, there is a mixed cup, don't resort that waste. Regard that waste as highly infectious. So all waste containers should be sealed and labeled to describe the content. Don't allow the support staff to pick up your waste before you label, before you prescribe the content, and even document the waste tracking log. Correct disposal rules can be selected based on the type of label that has been given. So we have the packaging of our waste. So labeling should be completely accurate and should contain the following: waste type, waste generator, ward or department. Meaning if I'm selling, working at the phlebotomy, so I'll be the waste generator and my department will be laboratory and section is phlebotomy. So date of waste generation, very important. Name of the person completing the label and the hazardous sample. And I want to see, you see the way those wastes are labeled. So in ideal hospital, good healthcare waste management system, the support staff should come up and pick the waste when they're already packaged and labeled like indicated in the pictorial above. So we also do some decontamination. So this is just the process applied to render the object or material safe by reducing or removing the bioburden. Like I've talked of the sputum samples. We have chemicals that we can use. We can do physical where we use the heat, steam, pressure. We have incineration. Then we have other sources like shredding, autoclaving. Yeah, so you also have to think about yourself. After handling waste, wash your hands. Yeah, remove gloves also and before leaving the lab. So that is very, very important. Storage of waste. Healthcare waste must be stored in a safe place, not in pit latrines that are not lockable. Ensure they are stored in a secure place. Keep boxes in a secure location. Keep safety boxes dry. You go to some of our hospitals, the safety boxes are filled until termites have grown in them. Keep written record or number of safety boxes received and disposed. This one will also help you when you are tracking and you are doing planning for waste. it is going to help you to know how many of this waste do you need. So the floor of that storage area should be hard standing with good drainage and be easy to clean and disinfect. There should have water supply for cleaning purposes, and then should be protected from the sun. Yeah, so these are also other indication of the storage area. So the storage area should be inaccessible to insect and rodents, very important. There should be good lighting and at least passive ventilation. The storage area should be located close to the patient area or to the fresh food store. Should not be located close to the patient or the food store. Supply of clean equipment, protective clothing, waste bag or container should be located conveniently close to the storage area. Then we have the collection of the waste. So the waste should be collected daily from the point of generation. You know, sometimes you do the audit and you find it is very early in the morning and the waste bin is full. Then when you ask, they say, we always collect our waste after 3 days. So the rule is waste should be collected daily from the point of generation. So if you are not generating much, we have small waste containers, 5 liters quantity. So we can be using that to avoid accumulating the waste. Specific routes should be planned, bags should be labeled, bags or containers should be replaced immediately, then supply of fresh bags or containers should be done. So when doing a waste collection, ensure that a trolley is used. It is not encouraged that our support staff lift up the waste with their hands. So they put it in a trolley, but not walk with the waste lifted. So the person in charge should ensure that adequate supply, 3-month supply of heavy duty gloves, soap and washing facility, the trolleys are available where they transport with the trolley. You should have SOP for handling of accident, incident, and spillage, which must be available. So during transportation, we can either do either on-site or off-site. So during on-site, we use trolley, but now when we have to support our waste off-site, meaning we have a different area where we do our waste disposal, we can use the truck, the designated waste truck that have been given. So we have biological waste management or disposal. So here we have the biological procedures. We can do autoclaving. We can do chemical inactivation or disinfection. You can do incineration, encapsulations, sanitary landfills, burial. You can do septic or concrete. Then we have inertization, which is basically a method of waste disposal that immobilize hazardous substances into stable, insoluble, and non-toxic form. Often it is using of cementitious or glass-like materials. So we have autoclaving. I believe we all know autoclave because we use it also in our laboratory. So an autoclave testing program must be routinely administered. And I believe you know the biological method where we use the culture, and that is the standard one. And we can also use the tape. Yeah, so the setting of the autoclave, the repair, the maintenance is very key. So when you are using autoclave as your method of waste disposal, you also have to ensure that your autoclave is working effectively. So we can also do incineration, which involves the use of thermal treatment. It can destroy pathogen and toxins by high temperature, reduce volume of original waste by 95%, and significantly, it reduces the amount of waste that now you take to the landfill for burial. So waste is converted into ash, flue gases, and heat. So this is very, very important. So we have some waste that should not be incinerated, like the pressurized gas containers, the sprays that we use, the insecticide spray, those cans. we should not allow them to enter into the incinerator. And that is why we need to segregate our waste well. We have large amount of reactive chemicals. For example, there are some chemicals in the laboratory that we should not allow to reach the incinerators. They will spoil the incinerator. We have the radioactive waste, which is basically disposed as per their lifestyle. They are being kept in lead containers. They wait for them to live for long until their lifespan expired. We have the silver salt or radioactive waste, halogenate plastic, mercury, and ampoules of heavy metal. So those ones should not go into the incinerator. So we have the sanitary landfills as a waste disposal. So we have properly constructed and operated landfill sites for municipal solid. Like in Kisumu, we have for solid waste, including healthcare waste. So we have treated healthcare waste can be safely disposed of in sanitary land site. And something to note, treated. Don't take a waste that you know is going to harm the environment to a landfill. We have safe burial practices. So every time waste is added to the pit, you cover. So it is a pit that has been dug to several meters or several feet. Let me talk of feet. Then you place the waste, then you cover with soil. Then when you bring in another layer, you cover until that pit is filled. So the filled pit should be marked with a peg or some other mechanism for identification. Then you dig another pit. It is very important for you to develop a laboratory waste management plan. So in this case, you need to have a designated responsible person. Sometimes we call them IPC focal person, safety officer, or healthcare waste manager. So then you conduct a healthcare waste management survey and invite suggestion. So during this survey, you can also be conducting audit and get suggestion from people how best can you manage your waste. Recommend improvements and prepare a set of arrangement for their implementation, then draft the healthcare waste management plan, approval and implementation, then review the healthcare waste management plan. So we have several supportive documents, and these documents, we have them, you can just Google and then you get them. They are very important documents that can help us. For example, we have the IPC manual. IPC manual is very, very important because it talks about waste management, waste segregation, infection chains, nosocomial infection. So you can Google and get that document. And these documents are also very important because we have some organization or some audits that requires the facility to prove the availability of these documents in that health facility. We have the safe management of waste from healthcare activity. So that's also a guideline by WHO. We can also download that. We have healthcare waste management training manual, and this one can be very productive, especially when we're doing training to our casuals and support staff. We have healthcare waste manual, which is very, very important. So some of these guidelines are available in the internet, and we can just download them and go through them. They can also be of great guide when we are preparing our SOP for waste management for healthcare. So we have expected best practices that in any system, any laboratory, any department is expected. We have training and awareness. Suppose you get a new staff in your lab or in your hospital, in your department. What is the first thing? You have to take that person through an orientation system. And orientation system, also you have to take this person through waste management, waste segregation, the different bits, because Sometimes you might assume that this is a common knowledge, but sometimes common knowledge is not common to everyone. So we really need to be concerned about this because we know the impact to the environment, if it is not done well, will cause more harm than if we take time to do the training. Sometimes we can offer the training through CMEs and also share these different guidelines with our colleagues. Ensure adequate resources are available. Sometimes we miss these basic resources that we need because of poor documentation, because sometimes we ask even the lab managers, how many packets of gloves do you require to use in a month? They don't know because we don't quantify what we use. So we are just working on trial and error. How many bins do you use? You are given an opportunity to allocate for the waste bin that you can use for 6 months. Yet you don't even know the allocation of bins you use in a week. So we really have to document this, and this will only be possible if we track our waste. So one key important document that we need to develop is a waste tracking document. Like, for example, I'm working in a laboratory. How many or what quantity of waste do I generate in that lab? And secondly, what is the end point disposal of my waste? Sometimes somebody might be picking up my Falcon tubes or sputum mags, but now they are using it for another source in the community. So what is the end point of my waste? Yeah. Compliance with policy guidelines. So we really have to understand, what does policy guidelines say concerning the disposal of gloves? What does the policy guidelines say concerning the disposal of contaminated cotton wool? Consistent and timely facility safety audits. When did you last do a safety audit? Yeah. Sometimes we just concentrate in the lab, but what about the maternity? Do you do a safety audit in the maternity? Yeah. Do you do a safety audit in our kitchen for the facilities that have wards? Then we have monitoring and evaluation. You really have to monitor the process. And monitoring sometimes requires you to go extra mile. You have to know who collects my waste. How does this person handle my waste? Because I can be a very good waste generator or a very good waste segregation. But now the person who collects my waste mismanage my waste at the point of disposal. So you really have to monitor the entire process. So in summary, proper waste management practice is a continuous improvement process. So I can say now, I want to pick up healthcare waste management as my improvement project. Then you monitor it through, then you evaluate. Is it workable? Then you see, where is that facility? Then waste minimization reduces cost, damage, and protects the public. So you really have to come up in various departments. How can you minimize waste? SOP on facility waste management plan should be available. So these are one of the things now we have to start rethinking. Do I have an SOP on waste management? So if I don't have, then I have to sit down, rethink, and probably a team has to be formed. Then we develop this SOP. Then we take our staff through the training of the SOP, make sure they sign the training log, and ensure that the SOP is being implemented. Proper labeling and weighing of waste bags should be done before disposal. So you need to have your waste tracking log. You have to weigh your waste. The person generating the waste or the person releasing the waste and the person that is picking that waste. And if possible, if there is an endpoint, there is somebody who works at the incineration department should be able to sign that he received the waste. That is what we call the chain of custody. For example, I released my waste. Then from releasing my waste, I cannot account for my waste. But now if I have a tracking document or an informative document that can help me track my waste, then I can say, in this facility, there is a chain of custody of waste. Like I know the waste is being generated here, and now my waste is ending at this point because there is somebody who is going to acknowledge that I've received your waste for final disposal. Then waste should be accumulated in the point of, waste should not be accumulated at the point of generation. And sometimes this causes a nuisance. You enter a laboratory and it is smelling through offices. So you really need to monitor your waste and when should I dispose my waste. Then develop a waste management plan. I believe from this presentation, we are going to sit down and develop a waste presentation. So take a healthcare waste management, protect patients, health workers, community. So we see like everybody is there. You are there, your patients are there, your community, which you also belong, is there. Segregation at the point of generation is the first and most critical step. So when you enter and disposal, reduce the risk of infection. Yeah. Injuries and environmental pollution. Very key. And before we do anything, before we dispose any waste, you know, sometimes you walk very early, you walk along the road, you see somebody has disposed a red bin liner on the road. Those are our small clinics and private setup. Mepatia chokoro akaenda akatupa. It is so sad. But they are forgetting that this same waste is going to end up in their water bodies. And they are going to pick this water and drink again. And you see some of the packaging that they do for water. Right now, you don't trust any water apart from the one you package in your home. Yeah. So every healthcare worker has a role and responsibility ensuring safe waste management. And then we can say, together, we can create a safer and healthier environment through responsible waste management. Thank you. And with that, I think I come to the end of the presentation and I give it back to Nelly. Thank you.
Thank you, Celine. Thank you for the elaborate tackling of the topic of waste management. You've really exhaustively done a good job on it. Thank you so much for your time and even taking your time to prepare so nicely and so educative on this. So members have raised some questions and contributions. I would want us to go through them in the next 10 minutes. Our time is so much spent. In the next 10 minutes, so I will start with the first question. This is from an anonymous attendee. Recapping of needles. I have a concern. Needles should never be recapped. When an officer is using open system to collect blood sample, what should come first? Discarding the needle from the syringe or transferring the sample to the tube with both needle and syringe attached? Celine, maybe you can react to that.
Thank you so much, Nelly, for that concern. Actually, recapping of needle is not allowed. I can say it is prohibited because of the risk that is involved in it. But now when it comes to sample and sample integrity, yeah, actually, right now, despite using closed or open system, we have tubes that have rubber top, like the EDTA tubes, yeah? And those tubes should have a tray or a tube holder. For you to minimize hemolysis, especially when you want to handle samples for full hemogram, you are expected to just put the tube in the holder. There is a tube holder. And because that tube has a vacuum, you allow it to slowly pick up your sample. until the level that the tube will require. Then you remove the entire content, both your needle and the syringe, and then you discard. But I want to say that in all laboratory, especially when you have a working system, a working procurement system, we don't even expect to find needle and syringes in the lab, especially in high difficult circumstances that we'll find the butterfly when you are not able to get a vein with the Vacutainer needles. And this is basically being raised in now to avoid the risk that is involved to the healthcare worker, at the same time the waste management. So I think I'll be able to handle that way. Thank you.
Thank you, Celine. Ivan Nacheo asked, so the waste should be autoclaved before disposal. He asked if waste should be autoclaved before disposal.
Oh, thank you for that concerning question. There are wastes to be autoclaved before disposal, like the wastes that are involved. Let me say highly infectious waste, pathological waste, wastes that have blood sample, we can autoclave them before disposal. But we also have wastes that do not require autoclaving. Like for example, I just want to dispose some papers. I don't need to autoclave that. So it depends on the type of waste. And probably because knowledge is everywhere, I will encourage you, Google more on the waste to be autoclaved, but not all waste should be autoclaved before disposal. Only the highly infectious waste. Thank you.
Well noted. Caroline Kiprop asked, how do cancer relate with poor waste management?
Excellent question. How does cancer relate to poor waste management? We've talked of wastes that are capable of causing cancer, in that probably you have some radioactive material or radioactive waste that have been mismanaged. Probably they have gone into the drainage system, and this system have gone back to our waters. We also have radioactive chemicals that when they get into your system in a smaller portion, they are able to alter the genetic system, your cells. And probably you know cancer is just the excessive proliferation of cells. So when these chemicals or these radioactive materials or genetic material, they get into your system, they are able to make yourself to multiply excessively, hence causing cancerous cells or tumors. So that is how poor waste management, especially the genetic waste or the radioactive waste, is related to cancer. Thank you.
Samuel Kayari concurs that this was a nice presentation, and he has two questions. One, would you consider disposal of used pipette tips and applicator sticks into the sharps container? And number two, what is the risk of the sanitation staff getting accidental pricks from used pipette tips and applicator sticks during emptying if you dispose these waste in the yellow bins?
Thank you for that concern. Actually, we have two types of pipettes, yeah? We have the pipettes that are used with automatic pipettes. The ones that have the yellow tips, the one that has the blue tips. You find that some of them are very sharp, and that plastic also is very hard. It is not like the normal plastic pipettes. So such we can consider them, and they should have their own sharp containers, especially where they are doing chemistry, where they are using those pipettes. And I believe they're no longer even being used because most of our chemistry testing have gone to machine learning and things are being automated. Then we also have the glass pipettes, like for example, and capillaries. So those ones will go into sharps. But we have the plastic ones. the soft plastic ones, like the ones now we have for HIV kits. So those ones will just go into the yellow bins. They will not cause any harm because they are very weak. Even if you touch them, they are very weak. So that's how I will categorize that. But now as the lab officer, I will assess what kind of pipettes am I using and which is the best way to dispose it. Thank you.
Thank you, Celine. Boniface Store asks, is burning of waste acceptable currently? And what other methods should be used to destroy the waste, especially the hazardous waste?
You've talked of burning of waste. I didn't get it well.
Yes, burning of waste. Is burning of waste acceptable currently? And then he asked, what other methods should be used to destroy the waste, especially hazardous waste?
Thank you. Actually, I've talked of, there's waste categorization. There is waste that you can burn, like the general waste, which just include the office papers, the packaging, like for example, our DT test kits, it has a packaging. Yeah, so that waste can be locally burned. Secondly, we have different waste disposal, especially for highly hazardous waste. The recommended is incineration. So you can take your waste for incineration. And then some people also have high prepared chambers, burning chambers, open chambers. So you can use that, but incineration is the best. So there are different methods of waste disposal as I've talked about. But burning, you can still burn the general waste. Highly infectious waste, we take them to the incinerators. Some people still use the chambers, but in our regions, with a lot of investment has been put, at least in each and every region, there's an incinerator. So you just have to work for a system of transportation to ensure that you achieve proper waste disposal. Thank you, and over to you, Nelly.
Thank you, Celine. Another question from Josephine Kiarie. Why should we weigh waste before disposal?
That's excellent. And that is something that we ignore. So if you don't weigh your waste, how will you account for your waste in the first place? Secondly, how will you even dispose your waste? Because, for example, you are using an incineration to dispose your waste. You need to know the kgs of your waste to enable you even purchase for fuel. So weighing of this waste is very important because it will facilitate and even guide in the procurement of fuel that is going to be used in incineration. Secondly, in an hospital setup, we have different departments. When we are doing our HMT meeting, it will help us to know in which department generates this amount of waste so that we plan for them in terms of bins, in terms of fuel, in terms of everything. So as much as we forget about to weigh and even track our waste, I still insist that this is a very important indicator that need to be tracked in a health system. And it is also very good for planning purposes. Thank you.
Thank you, Celine. Elizabeth asks, Elizabeth Yambo, kindly, how can we dispose of the big glass bottles such as acid bottles?
Oh, thank you. That is good. That is good, Elizabeth, my senior. Thank you for that concern. We have those big bottles like the ones for sulfuric acid. Yeah, probably those are glasses that can be meant to be used for recycling. Yeah, because we find that, for example, they have the amber color, and we have some stains like the Jameson stain that needs to be stored in that bottle. So you just need to sit down as a team and find how best can these bottles help you. And if they are not able to help you, sometimes if you look at the MSDS, Material Safety Data Sheet, The manufacturer also give a loophole of you turning the same bottles to the factory for the reuse. Yeah. Because if you just dispose them like that, they will harm the environment. At the same time, we don't need to take them to the incinerators. Thank you.
Thank you. Peter Etiang on the chat session asked, waste disposal is part of its management, but most facilities have deep pits where all waste are thrown and burned. Is this proper?
That's not proper. Over to you. It is not proper, Nelly.
Okay, Celine. Another question from Samuel Kipngetich Sigei. So he says that this is a very good presentation. A question, any waste generated in the hospital is considered contaminated. How will you ensure that it's safe for you to give out community, for example, empty cartons from the lab or from the pharmacy or kitchen waste? So he says everything from the hospital setup is contaminated. How do we ensure that, for example, boxes that can be used by community for something else, that are safe to give out?
That's a good concern, but we see that, like, for example, when the drugs get into the pharmacy, and maybe we get some reagents, like, for example, we've gotten tubes of reagents in big boxes. We don't encourage the keeping of the boxes in the store. So as the boxes get into the facility, the ideal practice is we remove the boxes and we isolate them in a safe place. And most of the facilities have used this to generate income within the facility. They sell these boxes and we've not have incidences of maybe a community being infected because of using a box. Yeah, so it is just how you handle them. And these are just reagents or drugs that have come with a lorry, and now you've removed your boxes and put your drugs in the store and you have your boxes there. You sell them at 10 bob each. If they are 40, you'll get 400 shillings. And then that 400 shillings, you can use it to buy soap so that you don't lack soap in your facility. Food stuff. For example, we have said that we have the waste segregation bin, and some facilities are using the black bin, some facilities are using the blue bin. So what you need to do is to ensure that the waste segregation is done well, so that that bin only has the food stuff. And this food stuff can be given to pigs. You sell them to pig farmers. Some people sell them to those who rear kitchen. And there's this thing that I said, that sometimes you can translate this in your local language. Like you say, "Ket chiemo te" in this container. So they know that all the food remains go into that black. So that will be safe and it will not harm. And we have people who are doing that. We have facilities that are doing that. And they have not recorded some harm because this particular waste comes from the hospital. Thank you, and over to you, Nelly.
Thank you, Celine. Maybe I'll take a last one here because of time. Peggy Obam asked, aren't we supposed to label where the wastes are coming from in terms of department?
Yes, I think I overemphasized that. You remember? I said you have to label your waste. You have to package your waste as a waste generator. You have to label your waste, label the department, label the person who has actually handled that waste before you release that waste into the other department or to the another person. So it has to be sealed, labeled with the department plus the person who has done the packaging before you release it to another level. Thank you.
Thank you, Celine. Thank you for taking your time presenting and enlightening us on the topic of waste management in our health facilities. We so appreciate that, the excellent work you've done from the chat. People are really grateful for the good work and the information that you've given us today. We really appreciate. And thank you, members, for attending to this webinar today. We really appreciate. that you took your time to be here to learn and just to get enlightened and to have this information. As some of us are saying, it's a refresher course, which is very good, and we appreciate that. And thank you to the LMSK leadership for organizing such an insightful webinar. And members, I will want to invite you for more of these insightful webinars and refresher courses and even insightful presentations from on Mondays, Wednesdays, and Fridays at the same time, 3 to 4:30. Kindly get a hold of the link, register, share it with your colleagues, and let's come and learn. For more of these interactions and those who are asking about the slides, kindly visit our website and you'll find the presentations there. You will interact with them, you'll ask your questions, and you'll be answered, and you'll find all the presentations so far that has been done. Have a good evening. I would like to bring this webinar to an end. See you next time.
Thank you.